Welcome to this video on hyperthyroidism. So let's start off by what does hyperthyroidism mean? Essentially means when you have too much of the hormones produced by the thyroid gland. The thyroid produces the hormones known as T4 and T3. So there's various causes as to why you can get too much of these hormones being produced. So we're going to start off with the most common cause, which is Graves' disease. Graves' disease is an autoimmune condition in which you get antibodies, IgG antibodies, that bind to the TSH receptor. By binding to the TSH receptor, they produce extra amounts of the T4, T3 hormones. Due to it being an autoimmune disease, you can also find different links with other conditions. These patients may also have type 1 diabetes, as well as Addison's disease, which is also autoimmune. Another cause is toxic multinodular goiter. This can be found more commonly in elderly women and is essentially where you get additional amount of T4, T3. Another cause is a toxic adenoma. This is essentially a solitary hot nodule present on the thyroid gland, which is continuously producing T3 and T4. Another cause is thyroiditis, known as de Quervain's thyroiditis. This is essentially inflammation of the thyroid tissue, and due to the inflammation, you get a release of the thyroid hormone. You typically find in thyroiditis that you get a hyperthyroid state at the start, and then this becomes a hypothyroid state, and then becomes back to normal, euthyroid. A good way to remember the differential diagnosis of thyroiditis is you normally have a painful goiter, so pain in de Quervain. Other causes are drugs. For example, if you are taking thyroxine and you take too much, you'll have too much thyroxine, so it'll be hyperthyroid, as well as amiodarone can cause hyperthyroidism. So let's talk a little bit about the clinical features of hyperthyroidism. So because the thyroid produces these T4, T3 hormones, which are responsible for metabolic rate, imagine if you have too many of these, you're going to get what kind of symptoms? Where you're going to get a lack of tolerance to heat because you're producing so much heat with the cell turnover. You're going to have loss of weight because you're having so much turnover, increase in sweating. You're going to get tremor, tachycardia. You're also going to get diarrhea, more irritable, affects your sleep. You get problems in females with your period, and in Graves' disease particularly, you get these eye signs. So you get lid lag, lid retraction, exophthalmos, ophthalmoplegia, as well as thyroid acropatchy affecting the nails. You can get some pretibial myxedema as well. So moving on to the investigations of hyperthyroidism, if you think about it logically, we want to see if there's too much of the T4, T3. So let's measure the T4, T3. We typically only measure T4. You can measure a serum TSH. We mentioned Graves' disease, which is an autoimmune condition with these antibodies, so we can measure these TSH receptor antibodies to look for that. We can also do some scans, such as an ultrasound scan or an iodine scan. And in Graves' disease, you'll have an increase in iodine uptake, whereas in thyroiditis, you'll have a decrease in uptake. So if we talk a little bit about the management of hyperthyroidism, the main choice of drug is carbimazole. This is a drug which inhibits thyroid peroxidase, and this works pretty well, about a 50% cure rate, normally treated for 18 months. Important note about carbimazole, one of the side effects is agranulocytosis, so you have to warn your patients if they get a sore throat or fever or become unwell that they must see a doctor as soon as possible. In terms of the sympathetic control that we mentioned earlier, because of the T4, T3 hormones, you're going to get this sweating, tremor, palpitations. We can treat this specifically with beta blockers, so that's why some patients will have propranolol, which is a non-selective beta blocker. If none of these work, you can consider options such as radioactive iodine. It's obviously contraindicated in particular people, for example, those who are pregnant, going to be pregnant, or those who are breastfeeding. The surgical option is also available, so you can get a surgical thyroidectomy, where you remove the thyroid gland, but this also has some risks, and if you think about where the thyroid gland is, you can cause damage to the nerve, so you can get recurrent laryngeal palsy. You can have an opposite effect, so from hyperthyroid you can make the patient hypothyroid, but then they can take replacement for life. Or you can get hypoparathyroidism because the parathyroid glands are so closely related to the thyroid gland. Please make sure to subscribe and give this video a like if you'd like more of these quick clinical videos to help you get through your medical school journey.